Hello, welcome to Dentalk. I'm Dr. Simón Pardiñas, a specialist in oral surgery, periodontology and implantology. Today we're going to speak about bruxism. Bruxism is the habit of clenching or grinding the teeth, usually during sleep. In this video, we talk about causes, treatment and consequences of this problem. Bruxism is the involuntary action of grinding or clenching the teeth without functional purposes. This disorder can occur during the day, although it usually occurs at night. It is estimated that it affects between 10 and 20% of the world's population, without notable differences in gender issues. Depending on the form in which bruxism occurs, the following can be differentiated. Teeth clenching. It is generated when the chewing muscles contract when clenching the teeth. As there is no slippage between the teeth, there is not such a marked wear. Teeth grinding. In this case, friction of the teeth is generated by contracting and relaxing the chewing muscles. This form of bruxism can cause great dental wear or attrition. Bruxism during the day. As its name suggests, it consists of unconsciously clenching your teeth while awake. It usually manifests itself with other habits such as pressing the lips between the teeth or biting the nails. Sleep bruxism. It occurs during the hours of sleep. It can be related to chronic obstructive apnea syndrome or sleep apnea. It usually causes dental, muscle and joint pain on waking. Bruxism is usually caused by a state of anxiety, but it can also have a genetic origin or can be caused by other diseases. Stress, anxiety, nerves, anger, frustration, or other states of psychological alteration are the main triggers for episodes of bruxism. In fact, there are certain types of personality in which its pathology is more frequent. Numerous studies have shown that bruxism can have a genetic origin and can be shared between different members of the same family. It's more common in children, teenagers and middle-aged people, although grinding can affect anyone. In children, there is a bruxism related to the stimulation and normal development of the face, mouth and teeth of children. This bruxism usually occurs during the primary dentition and usually disappears as the permanent teeth emerge. It can also be related to states of anxiety, nervousness or stress in childhood. Having a malocclusion or problems with the muscles of the mouth and face can cause unintentional teeth grinding. There are other diseases that are closely related to bruxism, in addition to the oral problems mentioned before. We include allergies, dementia, Parkinson's, hyperactivity, gastroesophageal reflux disorder, epilepsy, night terrors or other sleep-related problems. Some psychiatric medications such as antidepressants and stimulant substances such as tobacco, alcohol, caffeine or the consumption of certain types of drugs can favor the development of this disorder. One of the problems with bruxism, especially nocturnal bruxism, is the difficulty in detecting it. Bruxists are not aware of their situation until someone does not tell them or the consequences begin to be noticeable. One of the most common ways of diagnosis and control it is by visiting the dentist frequently. A qualified dental professional can perceive this problem on a routine examination. Bruxism can be mild, sporadic and have no consequences, but in the most serious cases it can lead to quite a few problems, such as wear, cracks and fractures, tooth sensitivity, muscle, jaw, ear pain and/or headaches, or sleep disorders. Bruxism causes dental attrition, a type of wear on the tooth surfaces due to contact between them. Bruxism can end up causing dental fractures, flattening or significant reduction in the size of the teeth, dental abfractions and involvement of the dental pulp or nerve in advanced cases. Grinding your teeth can damage enamel, the main protective layer of your teeth. This can make your teeth more sensitive to cold, heat or pain over time. Sleeping bruxism is highly connected with other sleep disorders. Grinding patients may be more prone to snoring or even sleep apneas that are pauses in breathing while sleeping. Insomnia is also closely connected with this situation. One of the most obvious symptoms is waking up with pain in the jaw, neck, ear or head. These involuntary movements can overload the TMJ, that is the joint located on each side of the jaw, that allows us to speak and chew. This can lead to TMJ dysfunction over time or cause contractures, strains or even injuries to other parts of the body. Treating bruxism is especially important in athletes, as it can increase the risk of injury. Now that we are clear about what bruxism is, what causes it, and what consequences it has, it is time to talk about the treatment for this oral disorder. Sometimes the problem can end on its own, but in cases of chronic bruxism, you have to try to control it. A bad shape in the bite can generate harmful contacts between the teeth when opening and closing the mouth. These premature contacts can trigger episodes of bruxism. It will be necessary to perform orthodontic treatment to restore normal occlusion, when bruxism is the consequence of a dental malocclusion. One of the possible solutions to reduce the effects of bruxism is to make a mouthguard, a plastic or resin device that is placed between the teeth and that helps to protect the teeth and the temporomandibular joints. These guards treat the symptoms, but do not eliminate the causes. To create a mouthguard, casts or digital scans of the mouth are taken in order to study the case. The patient can use it during the day, at night or throughout the day, depending on the intensity of the bruxism and the recommendation of the dentist. A TMJ physiotherapy specialist can help loosen and relax the chewing muscles, thus reducing muscle fatigue and headache. In addition, it can also teach postural reeducation. If bruxism has already caused severe tooth wear, the dentist may have to reshape the chewing surfaces of the teeth, or place inlay restoration or crowns to repair the damage and restore lost tooth structure. Some professionals may recommend the use of muscle relaxants and/or anti-stress and anxiety medication. The use of Botox injections in the chewing muscles may be advised to control this disorder in severe cases. Bruxism is closely related to psychological factors such as stress and anxiety, as we have mentioned above. For this reason, managing these triggers can help combat this disorder. Therefore, it is advisable to avoid vital stressors and to do relaxation exercises before sleeping. There are some home remedies that can help with this problem as well. It is recommended to avoid the consumption of hard foods and chewing gum, and to increase the intake of water during the day. Before sleeping, you can apply iced or moist heat to the jaw muscles and perform exercises, stretches or massages in the area of influence of the TMJ. Please don't forget to subscribe to our channel, and you can leave all your doubts in the comments of the videos. Thank you.